Hey guys, I just wanted to shoot y'all a little message, do a little quick overview of what tomorrow will look like. Y'all can email me with any specific questions, but hopefully this will give you an idea of what the plan is for tomorrow and also what your expectations are. So the board, I know you can't see this full board because of the lighting. It'll be available tomorrow, but I'm going to touch base on each thing that is on it. And this board and your checkoffs tomorrow are based upon what the Louisiana State Board of Practical Nurse Examiners says that you need to know and be confident in upon graduating this program. So it is our job to make sure that you're ready and that you feel knowledgeable. So as we discussed in IV therapy, your scope of practice says that you can perform tasks if you have the knowledge, the skills, and the ability. So we've gone over the knowledge, and you guys did submit me some paperwork saying that you had the knowledge, or some videos saying that you had the knowledge, but we didn't actually get to watch you do those skills and ensure that you had the ability, and we didn't necessarily feel comfortable signing our name next to that. So this is the form that will go to the State Board of Nursing, and I'm going to start at the top, and I'm just going to make sure that you know your implications for each. If something I say sounds unfamiliar, it should not, but if something I say sounds unfamiliar tonight, you pull up those videos and you watch it and you come prepared tomorrow, okay? Because your license says that you know these things and that you know how to do them. And at the end of the day, it's about keeping your patient safe. So if you don't feel confident in the area, you need to take personal responsibility, regardless of the events that took place leading up to tomorrow and leading up to your graduation, and take on that ownership and keep your patient safe. Okay. I do feel I hope that y'all know this well. So, but I just want to do this review just to make sure. So the first thing that's on this, the first skill is IV insertion. So the steps for IV insertion are to tie that tourniquet, to choose your vein starting distally, cleanse with the approved cleanser, insert the IV, looking for flashback of blood. You know, when you get that flashback, you know that you have entered the vein. At that point, flatten out your catheter and fully advance with a smooth motion, engaging your safety device. Pop your tourniquet, put a 2x2 under that hub so you don't make a giant mess. Apply pressure above the catheter, attach your extension tubing, and flush. That is what we will be looking for tomorrow when you start your IV. In regards to site care and dressing changes, that dressing does not need to be changed unless it's soiled. When doing so, you'll use an alcohol pad as to not injure your patient, and you must secure the device. Remember, there's nothing holding that catheter into the vein except for the securement device that you are changing. So should it get soiled and you need to change it, just make sure you are securing that hub. Also, your IVs need to be flushed every 12 hours with saline, not heparin. Heparin will be used for our central line, or per your facility protocol. So sometimes they may have you do it more often. Sometimes it'll be Q24, but pretty much it's usually every 12 hours. And then you'll rotate that IV site every 72 hours or per facility protocol. So it can't stay in, indefinitely. You must also document, initial on your IV at which time you inserted it, so we are aware how old it is, as well as in your documentation. In regards to central venous access care, that's the area, if I'm being honest, that I am most uncomfortable with you guys knowing, because we didn't get a lot of hands-on practice in that area. But if you learned in foundations how to put on your sterile gloves and you learned it correctly, then you can do this technique. You will need to, changing a peripheral IV dressing is not a sterile technique. Changing the dressing of a central line is, because it's going to the superior vena cava. So when you're changing that, you must wear a mask, your patient must wear a mask, and you must use a sterile technique. You will have a kit that you will open away from you as you as you open sterile packaging. You will apply your sterile gloves and you will cleanse it and put a sterile dressing on top of it. If you are not familiar with that, I posted videos in that module as well. you need to be familiar and you need to be able to, at bare minimum, verbalize and be able to put on sterile gloves safely. So that is your IV, your central venous access care. In regard to flushing, we will flush those with heparin if not contraindicated by our patient allergy. Now, in regards to flushing central lines or drawing blood from central lines, you have the skill and ability to do that, but you must meet, your facility must allow that. So it is your job to know what your facilities, what their guidelines are for LPNs. Okay, your board says yes, your facility may say no. So that is something that you must be very diligent in keeping care of, because it's may vary across locations. So when we are drawing blood, we always are scrubbing our hub for a minimum of 30 seconds with the alcohol or, whatever your approved cleanser is at your facility. Scrub that hub. If you're drawing blood, you will discard 5 milliliters and then draw your blood, flushing with saline and then with 5 milliliters of heparin. If you are giving medications, remember, if there's 2 ports, it doesn't matter which one you use, because they're going to be emptying at, they're not going to mix in the line. So you can have 2 different medications going into those ports at different times if it is a central line, and you have 2 ports. In regards to pushing, never use anything less than a 10 cc syringe. And you will, when you're pushing medications, you will be sure to cleanse the hub, always cleanse the hub. That goes without saying. Cleanse the hub, and then you will ensure patency. So you will flush, and then you will do your additive, which will be your medication. You will give it at a rate per your medication book, whatever the rate is for that medication. If it's over a minute, dilute it as such. If it can be given quickly, you give that medication however it is ordered, however it is safe to administer, with the push-pause method. So you push a little bit, pause, push, pause, and then you follow it with a flush. And then if it's done via central line and it's time to flush with heparin, you can flush with heparin as well. But you saline, medication, saline. In regards, so that's IV, we talked about central venous access care. We talked about IV site care, IV insertion, and IV push we've talked about. Primary and secondary lines, you just need to ensure that you are not touching that spike. You are going directly into that closed system. You're not touching it. If you contaminate it, then the whole bag is no good, and you need to be a diligent nurse and acknowledge that you contaminated it. So that's IV primaries and secondaries. Your checklist, I will post a PDF of it tonight so you can look over it. And also with your IV calculations, remember your pump will run in milliliters per hour. So if you are given your volume and you're told that you want to run it over 8 hours, you put your volume on top and you divide by your amount of hours, and that will give you your milliliters per hour. If you're manually calculating, that is the only time that your drop factor comes into play. Your drop factor will be found on your IV packaging. So just in order to help you guys remember, if you have a pump, it doesn't matter what the drop factor is because your pump is handling it. If you don't have a pump, then you must calculate that. The acronym for remembering that 3-step method is Miss Harley gave me her money. So that first one is milliliters over hour times drop per minute, which is your drop factor, times minute per hour. You'll cross multiply and you'll come out with drops per minute every time. All of that stuff should not sound foreign. I hope it doesn't. I'm looking forward to seeing y'all. I miss you all, and graduation is very, very close to being here, and I'm proud of you guys for making it this far. If you have any specific questions, please email me. The groups are posted. So you will be here. You will take your exam with Miss Salmon. You will be here after your exam. You will either be in group A, B, or C. You will remain with your group until I tell you to switch, and you will have practice at each location. Beginning, I have to look at the schedule, honestly. I believe it's beginning at 11. We will start calling you in for checkoffs. So you are welcome to leave. If your group does not check off until 1:30, you are welcome to leave and come back. I feel that everyone should continue to practice as long as they can. But once you check off, you're free to go for the day. And if your checkoffs aren't until later in the day, you are free to leave and come back. However, we expect that you are ready for that checkoff upon arrival. Should you fail your checkoff tomorrow, you will come back again that afternoon, after at 2 o'clock basically, and check off. You'll wait. If you come in there unprepared and you're not ready to check off, then you'll come back after everyone else is finished. Our goal tomorrow is to get all of your paperwork for the board so that we can send it to them when you graduate, and that we can say they're ready. And we're proud of y'all, and we'll see y'all tomorrow. And again, email me if you have any questions at all.